Facial nerve and its disorders. Let's start with the cause. It runs from the bones of the brainstem to the parotid. It is a mixed type of nerve, which means it has both two components, sensory and the motor. Sensory is the afferent part, which means it carries the secretions or the sensory innervations, and motor, where it goes to the glands and gives it efferent part. Sensory is also known as nerve of Risberg, which has two components, taste and the general sensations, while motor has two components, neck-rhymal and the salivary gland components. Components of the facial nerve. It is also termed as patient visceral efferent, which means it is a motor root. Efferent is a part for the motor. It supplies to the muscles of the second brachial arch, which are facial muscles, auricular muscles, which are vestigial in nature. It means since the human development occurred, it is now non-functional in the human. Stylohyoid, digastric posterior belly, and the stapedius muscle. Coming to the general visceral efferent. These are the somatic visceral efferent. This is the general visceral efferent, which gives the secretomotor fibers to the lacrimal gland, salivary glands like submandibular, sublingual, nasal mucosa and palate are the extra here. Special visceral afferent. Afferent, these both are the sensory components. Now this gives the sensory innervation to the anterior two-third of the tongue, soft and hard palate. This is mediated by the chorda tympani nerve, and this is mediated by the greater petrosal nerve. Now these taste sensations are given to the nucleus tector solitaris in the brainstem. Coming to general somatic afferent, it is given to concha, external auditory canal, tympanic membrane, where repeated infection may occur lead to herpes zoster infection near the geniculate ganglion. Now let's do some of the branches. It has three parts, which are intracranial. It starts from the pons till the internal acoustic meatus. From the intratemporal, it will come from the internal acoustic meatus to the sternocleidomastoid foramen. And after exiting from the sternocleidomastoid foramen, it gives some peripheral branches which are termed as an extracranial part.